Dr. Michael Shingles joins us from the MSU Health Team. Welcome to the Morning Blend.
Thank you for having me.
I want to talk to you about athletic injuries because I know you see a lot of them. What's your advice for injured athletes who aren't sure if they can train or play with an injury?
It's a really good question. So any athlete that's used to knowing their bodies and their sport, when they have an injury, they often get the fear, or is this something serious, is it not serious? There's certainly the desire to continue to play, to continue to compete, to continue to work. And sometimes that's fine to drive through an injury. Sometimes it's not. So if you're not sure, the best thing to do is have it evaluated by somebody that takes care of injuries. Usually at MSU Sports Medicine, we try and get patients in within 24 hours. We have an injury clinic on the weekends. So we try and get athletes in when they initially get hurt so we can help them with that decision process to determine whether that injury is something that you can sort of play through, work through, it's going to get better with time, or is it something you're going to do more damage, you're going to cause problems that will prevent you from doing the things you want to do down the road. So we need to reassess the situation and do the appropriate treatment.
Right. Is there any injuries that athletes can play with?
Athletes can play through a lot of injuries, and it just depends on sometimes. So, for example, an ankle sprain, that ankle sprain more than likely will improve with time. Depending on the severity of the ankle sprain, you can sometimes get back quicker from that ankle sprain. There are some risks. You don't want to hurt yourself, have another injury because you are not functioning. But if you can function and play through an injury like an ankle sprain, you can compete, you can protect yourself. Eventually that ankle's going to calm down, and you could probably get away with working or playing a sport or getting through an event with something, say, an ankle sprain.
Is there a process or protocol that you use to determine when they can go back to playing their sport?
Yeah, if we're seeing an athlete on the sideline or at the time of the injury, we have to do that all the time. So if we have an MSU football player go down, it's what we're assessing. Is this something more serious that we're putting them in danger by putting them back in? Or is this something that we can send them back in? And part of it's how functional they are at the time of the injury. If they can perform and do what they need to do, and again, tolerate the symptom, then we can usually let them play through that.
And I suppose you probably use a lot of research because of where you're at.
Not only do we use a lot of research, we're doing a lot of research at Michigan State see a lot of ACL injuries, both in athletes here at State, but also athletes in the community and around the state of Michigan. And because of that volume, we have an ACL lab here on campus, and we send our athletes there. You can't play through an ACL. You're going to do more damage. And once you get that ACL to heal, you need to tell whether or not they're able to go back to sport.
And we're going to put your information on the screen. Doctor, thanks so much for joining us this morning.
Thanks for having me.